What about me? I look like I'm still the same.
Yeah, because you wear the same thing every time.
Oh, am I?
Yeah,
Does that sound reasonable to wear the same thing all the time?
Yeah, it is. It's good. It's good. It's good to wear the same thing every single week. Okay, we are back with the Plastic Surgery Podcast. This week we have two topics. We have skin grafts and skin flaps. I have no idea about either of them. What is a skin flap, briefly, and then describe what a skin graft is?
Basically, what a skin graft is you're taking a thin layer of skin off of one part of the body and moving it to an open wound on another part of the body. And what happens is that that piece of skin, it has to be relatively thin, almost the thickness of a piece of paper or two. What happens is that the body forms blood vessels that grow into that skin graft. So it's a piece of skin that winds up being placed on an open wound to get it to heal up faster. And the area where the skin graft is taken from can either be, if it's what we call split thickness skin graft, where you take just the very, very outer layer of skin and you're leaving back the hair follicles behind. That area just kind of grows new skin in about a week or so. And then, because it's so thin, the first 24 hours or so, what happens is that there's diffusion of nutrients that come up from the open wound, and they feed that skin graft during that time period to keep it alive. Because if you take that skin graft, let's say, for example, you take it off in one part of the body and just leave it on a table, and you leave it overnight there, it's going to die, right? But by putting it on an open wound, what happens is that at the very beginning, you get a lot of nutrients that diffuse into that skin graft. They actually keep it alive. And then what happens is then you get these budding up little tiny capillaries, which are little tiny blood vessels, that start feeding it. And then over the course of maybe 5 to 7 days, blood vessels grow into this graft and they keep it alive. So that's a skin graft. And if it's like a full thickness skin graft, which is what we take all the way down to just where the fat begins, and we generally use those typically on the face or on the hands, somewhere where you need a little more mobility. And then the donor site where you take it from, we usually just close up because it's usually a smaller area that we're taking. Whereas a split thickness skin graft, we can take large areas of skin and move it to another part of the body because we know that that large area of the skin that was where the skin graft was taken from will eventually heal on its own. But it should be about 7 to 14 days, roughly, for it to heal fully.
So a skin graft is basically you're just taking the outer layer of the skin off of one area and putting it on another area. Right. And that is for less serious wounds?
So the indication for a skin graft would be on areas where the wound is, let's say, for example, down to and including down to muscle tissue, let's say, for example, even over top of bone, as long as there are blood vessels that are in that area.
And then so once you take that graft from one area and you move to another area, what happens to the area that you took the skin off?
If it's as I mentioned, a split thickness skin graft, when you're shaving that outer layer of skin off, and let's say, for example, if you maintain what we call the skin appendages, which are the little hair follicles that are in the skin, and the sweat glands that you have in the skin, those all have epithelium in them. So if you take a surface area, let's say if it's this big, the epithelial cells that create skin are not only going to come from the edges, but they're also going to come from within the graft.
So it heals by itself.
Exactly. They're like little seeds of epithelium that come from the hair follicles and the sweat glands that actually start spreading across. So you have a lot of those epithelial appendages that actually allows that skin area to heal pretty quickly.
So why would anyone need a skin graft then?
Patients that let's say have a bad injury where they lose some skin, or if they have a burn, or if let's say a patient has cancer and they're removing a large area of skin that you can't bring together again, then you need something to cover it up. But sometimes skin grafts aren't the best, result for the patient. For example, the last thing you want to do is put a skin graft, let's say, for example, on the face that causes significant deformity when you can do what we call a skin flap.
Okay, so we discussed skin graft. Let's go into skin flap. You just mentioned it. It is what exactly?
Skin flap is a little different in that instead of taking a piece of tissue from another part of the body without its blood vessels and putting it on a recipient site. This is different because a skin flap has its own blood vessels that feed it. And there are two different types of flaps.
Mm-hmm.
There's one that is what we call a random pattern flap, in that you have a random blood vessels that just sort of feed that skin. As long as you keep the width of that flap wide enough to give the blood supply. So there's a ratio that we go by. And those little blood vessels will feed that flap up until a certain extent. But if you go too long and you have a narrow base, let's say, for example, where the blood vessels come in, the tip will die. So you have to kind of figure that out. A axial pattern flap actually maintains a blood vessel from its point where it enters, let's say, for example, somewhere where it enters the skin layer. And then that blood vessel actually is like a little snake, and it goes right through the skin flap. And that feeds, it could feed a whole island of tissue. And it could be as long as you want, as long as you keep that blood vessel intact.
So a skin flap has its own blood vessels.
Blood vessels, right, exactly. So there are different types of skin flaps that we have that we work with.
So give an example of a situation where you would use a skin flap over a skin graft.
Okay. A skin flap is an area where, let's say, for example, if we have a patient that has, let's say, a large area removed from their cheek because of a cancer, let's say, for example, then in that scenario, instead of putting a skin graft that may not look very good on the face, we would do a skin flap. We would rotate tissue that has blood vessels in it into the wound in a way that maintains the blood supply to that skin flap, and so that we can close it and also close the donor site at the same exact time. So there are different types of techniques that we use to do that. So we design a flap that allows us to move the skin over and also close the skin from where we take it in a way that does not cause deformity. So there are all kinds of flaps that we can do to have its blood supply.
So there are cases then where you take flaps from different parts of the body and
then you can mobilize them, right?
Right.
So to take it a step further, we have what we call the pedicled flaps, which are axial pattern flaps that have a main blood vessel that feeds it. And you can actually take that tissue and rotate it in a way to cover areas within the proximity of where you're working, where it's still attached to the blood vessel. And that's called a pedicle flap. It could be skin, it could be muscle, it could be fascia. Basically, those are the typical ones that we usually use. But we also do what's called free flaps, which are microvascular flaps, where we actually take, let's say, for example, skin from another part of the body, and it has skin and fat tissue and has the blood vessel. We actually take that piece of tissue altogether, where we dissect the blood vessel that feeds that area, and we can actually disconnect it. And on this, what we call auto transplant, take that and move it to another part of the body. Let's say we take it from the leg or the thigh, and we can move it up to the face, and then connect it under a microscope, an artery and a vein.
How precise do you have to be when
Very precise.
You have to,
because it's a lot of hand-to-eye coordination. And when you're under there, you have to make sure that every little micro movement you do has to be perfect, because if it's not, if you just kind of budge just a little bit, let's say somebody's inexperienced, you can literally tear up the blood vessel that you're connecting.
And how do you connect the blood vessels? Like walk me through the process.
Obviously there's blood going through it, so we have to stop the blood, and we put temporary clamps on the blood vessels, and then we approximate them, and we get them all ready by cleaning them and washing them with
the blood vessels.
Yeah, the blood. We wash them with a little anticoagulant fluid, just to clean out any clot that might be in there or whatever, and get them all prepared. And then we approximate them with a special type of clamp, and then we basically take a little tiny fine sutures, and we start putting stitches all the way around.
Last two questions I said we'll combine them into one. Which is used more, skin graft or skin flap, and then which one is more difficult? From what you're saying, it sounds like the skin flap is more difficult than the skin graft.
Depends on what part of the body and how large it is. So you'd have to tailor to the patient.
Right.
So let's say, for example, I'm working on the face. I tend not to use skin grafts on the face because they may not look as good on the face. But sometimes the wound is so large, you don't have a choice, right? Skin grafts are reserved for areas where you need to get coverage of the wound, and it's too large to bring together, and that's typically usually what you have to do for those. However, having said that, though, there may not be a good place to take a skin flap to close an area, and a skin graft might be better.
Would you say you use both relatively equally?
Well, mostly so the patients that are sent to me, referred to me, are usually cases where the person that is sending me the patient, let's say it's a surgeon, feels more comfortable that I close the wound. If it needs a skin graft, a lot of times the surgeon will probably do the skin graft themselves.
Okay.
So that's kind of a little more straightforward for them. But if it needs more planning, and it's in the face, and usually it's usually going to be a skin flap. So the majority of what I do in my practice are flaps.
So which one do you find most difficult?
Well, I think that that's a hard question to answer. It depends. Sometimes a skin flap is easier to do because it's right there. You can kind of rotate it in and stitch it in place, and you're done and you're finished. Whereas a skin graft, you have to take the skin graft, you got to, stitch it in place. Then you have to do different types of things to keep it from moving, and so that takes a little more time sometimes.
So yeah, I mean, it could, in one situation a graft could be easier, in another situation a flap could be easier.
Exactly right.
But overall, just real quick because we're almost out of battery. Which one looks better? Like, which one do you think looks better for the patient?
It all depends. It all depends. You can make a skin graft look beautiful, okay?
Yeah, okay.
It all depends on where you're putting it and how you put it in and so forth.
Gotcha.
Because I could put a skin graft on an area, for example, on a certain type of patient, and it could be almost imperceptible.
Right.
Okay, if I do it a certain way.
Right. And then same thing with the skin flap.
Exactly right.
It can go either way.
Right, exactly.
Okay.
Exactly. So you can make it look very, very good, and depending on how you apply it.
Okay.
Okay, does that answer your question?
That does answer my question.
Right.
Okay. That is all we have time for the second episode of Skin Grafts and Skin Flaps. I definitely learned a lot today. We will catch you guys next week. Stay tuned. Make sure to subscribe. Hit that subscribe button. The Plastic Surgery Podcast is going to be probably every Saturday. So just keep a watch out. We're going to be talking about a lot of interesting things in the future. Thank you guys for watching.